You probably haven't put much thought into how you sleep at night, but believe it or not, your sleeping position can actually impact your health, and for real. Each way you snooze has some pros and cons tied to it that you should think about before crashing out. Like if you sleep on your back with a pillow under you, it might help a sore back, but also make sleep apnea worse potentially. Sleeping on your side could be better for apnea, maybe, but might bug your spine. If you've got heart issues going on, you'll probably want to avoid catching ZS on your left side. That position may move your heart around in your chest and change its electrical activity. Keep watching to learn why sleeping on your left side may be bad for your heart. We'll also look at the best and worst sleeping positions for people with heart conditions. The connection between heart health and sleep problems is so tight that some heart centers actually have sleep specialists working there. That's the case at Baptist Health's Miami Cardiac and Vascular Institute in Florida, where Dr. Harneet Walia is the director of sleep medicine, and she's always teaching her patients about how sleep, heart health, and general wellness are all tied together. A lot of times, people don't get how big of a deal sleep troubles can be for your heart. Dr. Walia says it's like having high cholesterol. You might not know it's doing bad things until you get treatment. She explains, many times, folks feel tired, fatigued, and have issues sleeping, but sometimes they don't have symptoms. Still, it's impacting your body, even if you don't realize it. Dr. Walia decided to focus on sleep medicine after seeing how big an impact sleep has on heart health, and she remembers a patient early on who had resistant hypertension. His blood pressure stayed dangerously high, even though he was taking 4 different meds for it. The medical team had him do a sleep study, which showed he had sleep apnea. After he started using CPAP therapy to treat the apnea, his blood pressure improved dramatically, and so did his overall well-being and quality of life. Experiences like that made Dr. Walia realize just how crucial sleep is. Even if you're doing all the right things with diet, exercise, and medication, undiagnosed or untreated sleep disorders can undermine everything. Getting enough high-quality, restorative sleep helps your cardiovascular system function properly. It also boosts your mood, energy levels, and ability to handle stress. So while medications definitely have their place, Dr. Walia believes sleep has to be part of the equation too when it comes to heart health. She finds sleep medicine incredibly rewarding because often something as simple as a CPAP machine or changing sleep habits can radically transform patients' health even when other treatments have failed. Is sleeping on your left side bad for your heart? There's not much research looking at if how you sleep affects your ticker, but some studies hint that sleeping on your left side can put more pressure on your heart. Back in '97, scientists first spotted that sleeping on your side changed the electrical activity going on in the heart that they track with ECGs, and they noticed it more when people were lying on their left side specifically. A study from 2018 found that sleeping on your left side changes your heart's electrical activity, according to ECG readings. They used a kind of imaging technique called vector cardiography to see the heart shift and turn when people slept on their left side. These changes happened because of the heart moving around, and when people slept on their right side, the readings barely changed at all. That's because in that position, the thin layer between the lungs called the mediastinum keeps the heart still. Anecdotally, people with congestive heart failure often report discomfort and trouble breathing when sleeping on their left side. What about sleeping on your right side? Sleeping on the right side can be useful for some folks with heart issues. Lying that way keeps the heart more stable compared to other positions, and it helps avoid changes in things like heart rate and blood pressure that could cause problems. Also, when on the right, the heart's positioned farther from the chest wall, so it's not getting squeezed as much. That prevents extra strain, which helps people relax into a deeper sleep. There's still some debate about whether sleeping on your right side is better for the heart. Some sleep gurus think snoozing on the right could squish your vena cava, that vein that goes into the right section of your heart. But so far, there's zero proof that right side sleeping amps up your chances of developing heart failure. Pillows and positioning aids. The use of pillows and other cozy helpers can make sleeping positions for heart patients way comfier and safer. Wedges are handy for easily propping up the torso. These supports help people stay in a decent sleeping spot, give some trunk stabilization and support when lying on their side, and cut back feelings of heartburn. Slipping a pillow between the knees also helps with rolling on your side so the spine, hips, and pelvis line up better. How you catch your sleep plays a huge role in getting good rest for heart patients, and the right position will be different person to person. Mainly, the goal is achieving chill, cozy sleep that helps the heart stay healthy and reduces risks from sleeping issues. By teaming up with their doc to lock down an ideal sleeping position, heart patients can upgrade their sleep game and minimize any risks that might pop up. How you should sleep if you've had heart failure. If you've got heart problems, chat with your doc about sleeping positions to skip. Resting on your right sides may be best for heart failure peeps. Some say it could limit blood flow back to the heart, but there's not enough proof it's harmful. And if you ain't got sleep apnea or breathing issues, lying on your back could also work. One 2015 study looked at the effects of chilling face up for folks with chronic heart failure. Researchers found lying face up was linked to worse oxygen levels, breathing mechanics, and blood flow compared to sitting. Snoozing on your stomach might help with sleep apnea and snoring, but can also cause neck or back ouchies. Untreated sleep apnea ups your risk of heart failure, and lots of people deal with both. Sleep positions to avoid if you have a heart condition. It's still not clear what the best and worst sleeping positions are for people with heart conditions. There's some evidence that sleeping on your left side may shift your heart and disrupt your heart's electrical current. Also, many people with heart failure report having trouble breathing in this position. Sleeping on your back can worsen sleep apnea and snoring. You should speak with your doctor before sleeping on your back if you're dealing with any breathing issues. Is it bad to sleep on your stomach? Sleeping on your stomach can negatively affect your spine and cause discomfort during the day, but some modifications may help stomach sleepers. Is it bad to sleep on your stomach? The short answer is yes. Although sleeping on your stomach can reduce snoring and diminish sleep apnea, it's also taxing for your back and neck. That can lead to poor sleep and discomfort throughout your day. If you're pregnant, you should be especially careful about your sleeping position and avoid sleeping on your stomach if you can. Sleeping on your stomach can be rough on your body. I'm talking back pain, neck pain, tingles, and numbness, the works. All that weight right on your spine for hours puts crazy stress on it. The spine's this main highway for nerves going all over, so if it gets pissed off, those nerves make the rest of you pissed off too. It's like pain that radiates everywhere the nerves touch, and next thing you know, you're wide awake because your arm fell asleep while the rest of you was trying to sleep. Or your back is killing you. The spine tension causes problems all over the body, makes it tough to get quality sleep or feel rested by morning after a night fighting off pain signals from irritated nerves. Mayo Clinic says stomach sleeping strains the spine extra, since most body weight concentrates right there in the middle. Hard to keep the spine neutral in that position for long periods. I think that's why so many stomach sleepers have chronic pain eventually, if they don't change something. The spine takes a beating over time, unless you're really careful and intentional about supporting it right. And then there's the whole issue with your neck. I mean, unless you've got some special talent where you can breathe through a pillow, you kind of got to turn your head when you're sleeping on your stomach. But that twists your neck out of whack since your spine and head aren't lined up right. And you probably won't notice anything wrong after doing it just one night. But over time, you could end up with some annoying neck troubles. The worst problem you really don't want to end up with is a herniated disc. What happens there is one of the gel discs between the vertebrae in your neck ruptures or bulges out. When that gel starts pushing on your nerves, ouch, you'll feel it for sure. No fun.